everyone. This is the weekly update for COVID-19 in Butte-Silver Bow, brought to you by Southwest Montana Community Health Center and the Butte-Silver Bow Health Department. And with me today, I'm Karen Sullivan, the health officer for Butte-Silver Bow. With me today is Dr. Serena Brewer from Southwest Montana Community Health Center. What we wanted to talk today about are a variety of issues, but maybe beginning with flu season, entering into what is already a difficult health situation in our community. Dr. Brewer, do you want to talk about flu and maybe how people can distinguish between flu and COVID symptoms?
Sure, I'd be happy to. So we know that this time of year we traditionally start thinking about cold and flu season, and now we have the added difficulty of adding coronavirus into that. And how do I tell if I have a fever, whether it's a cold or the flu or coronavirus? And unfortunately, there's no simple answer. You can experience fevers and chills, a cough or sore throat, headaches, muscle aches, even some GI symptoms like nausea or vomiting or diarrhea with coronavirus and with influenza. Probably the biggest difference between the two is that people with influenza do not typically experience loss of smell or loss of taste, and people with coronavirus can, but do not always. What we would really encourage people to do if you're not feeling well is to see your primary care provider. That's really the best way to determine what's going on.
Wonderful. So it will be difficult, but at the end of the day, seeing a primary care provider is a good idea. We're entering into a difficult time in Montana with yesterday, which would have been October 7th, Montana having its highest number of confirmed daily cases ever. And I think it's fair to say that our state is moving in the wrong direction. I think those simple public health precautions that are free are still in order.
Yes, we would really encourage you to wear a mask. I'm in the habit of wearing my mask, as you can see today, inside, but I do this in the office. I sit in close quarters with people, and so if you are someone who works in close contact with other folks and can't maintain that social distance, we would strongly encourage you to think about wearing your mask indoors as well as when you're out shopping and around other people. Wash your hands as often as you can. And the hard part for all of us is we need to start thinking about backing off on our social activities. Maybe we don't go out to dinner as much as we have been in the last couple of months because things seem to be going okay. Perhaps we start cooking at home more and we limit our errands to when we absolutely have to run essential errands.
Thank you. I think that all of those are relatively easy precautions. I think the social, backing up socially is hard on people. What do you have to say about people's mental health in times like this? And people's resilience to stay with it and stay strong.
So that we know as Montanans that we tend to be very resilient and we encourage resiliency. But we also know it's hard on a day-to-day basis. If you are experiencing struggles with your mental health, if you're feeling anxious or depressed, we want you to reach out to your primary care provider. If you have a counselor or a therapist that you see, reach out to them as well. But most importantly, reach out to your friends and family because you would be surprised the number of people who feel the same. And just that daily contact with one another, whether it's as simple as a text or a phone call, can make all the difference in the world for them, but also for you. So we really encourage you to utilize your social contacts. It's hard not to be around them and not to be face to face with them, but still reach out.
I think I do know that at the health department we follow a lot of metrics related to COVID: positivity rate, number of cases per week, simple measurements like that. I think one of the most intriguing and interesting metrics that we are following as a county is the measurement of the SARS-CoV-2 virus in our wastewater. I did want to let the public know that Butte-Silver Bow has been testing wastewater at Butte-Silver Bow Metro Sewer, and the last two samples have found the virus was detected in the wastewater. This is conducted by a company called BioBot, and they're very accurate in their prediction of about how many cases our county can expect. The motto of the company is "Everyone pees and poops," which is true. And it's amazing what the company can do. They originated out of the opiate crisis, so that they could detect opiates in the wastewater. And when the COVID event occurred or began, they thought, well, let's test wastewater for COVID. And now in Butte-Silver Bow, the virus is detected in our wastewater, which I find fascinating. But it's another marker of science and fact that the virus is alive and well in Butte.
It is, and it's one more reminder that we need to do our part to try to keep the levels of infection down by following those simple instructions like we talked about before.
Wonderful. The virus is here, folks. We wish the best for you and your family and encourage you to do everything you can to keep yourself and your family safe. Thank you, Dr. Brewer.
I just want to put in a plug. The health department is sponsoring a community-wide COVID testing event Saturday, October 17th at the Butte Plaza Mall from 12 to 4. You do not have to be a contact of a known case. You do not have to have symptoms. If you would like to be tested, the testing is free. Please come see us between 12 and 4.
October 17th, and that is Dr. Brewer keeping me on my toes. I forgot to mention that. Thank you so much.
Thank you, Karen.